the Honorable Marcel Liebert, Ministry of Health, Social Services, Community Development, Culture and Gender Affairs, other distinguished ministers of government, members of the Diplomatic Corps, Mr. Raphael Archibald, Project Coordinator, colleagues from other development agencies, United States Agency of International Development, permanent secretaries, ladies and gentlemen, good evening. On behalf of the President and staff of the Caribbean Development Bank, I would like to express our appreciation for the invitation to participate in the opening ceremony of this New Horizons Rehabilitation Center. The Caribbean Development Bank is pleased to support the enhancement of child development services in St. Kitts and Nevis and commends the government and people of the Federation on the opening of this rehabilitation center. This center, as you know, is a central part of the architecture for improving the quality of custodial care and the promotion of restorative justice for at-risk children and young adults. However, it is within the wider framework of child protection services and juvenile justice provision, with emphasis on rehabilitative care of young offenders. The ultimate aim is the reintegration of offenders into the society as productive members of the community who embody characteristics of the ideal Caribbean and St. Kitts and Nevis person. Such a goal is indeed not lofty, but realistic expectation for every child, with rights that are clear and responsibilities that enable personal growth and development. Indeed, as small, vulnerable states, the mobilization of every person is important. Such small states, like St. Kitts and Nevis, cannot afford the non-utilization of all of its human resources or the degeneration of any of its precious children into extended antisocial and criminal activity. Under the Child Development Project funded by the bank, this rehabilitative center is part of a holistic approach to address the individual and social risk factors that increase the probability of juvenile offenses. These factors include poor educational attainment and the lack of school connectedness in particular, inadequate psychosocial support systems and structures, child abuse, and socioeconomic disadvantage. Children are youth who are performing below standard in school and who lack the life skills necessary for personal development, who are themselves victims of physical and sexual abuse, and who are from dysfunctional families, are most susceptible to criminal activity. The CDB recognizes that the response should be multifaceted, multisectoral, and integrated, designed to address the systemic deficiencies which minimize both the quality and reach of the range of services that are available to children and youth. Both prevention and remediation services together with policy and programmatic reforms are needed as part of this comprehensive system. Friends, in this regard, the project supported institutional reforms, capacity building to address the needs of children at risk and those who have come in contact with the law. These include a system of diagnostic assessment for the early detection and remediation of learning deficits and behavioral difficulties, training of teachers in counseling and behavioral management, training for officers of the juvenile court system, review of the foster care system, and establishment of a management information system for the Department of Probation and Child Protection Services. Consistent with the focus of development effectiveness, we must stress that the success of the project in general and the New Horizons Rehabilitation Center in particular will be based on the extent to which the outcomes of the project are achieved. The intervention, when designed, anticipated an impact leading to a reduction in juvenile crimes, the successful reintegration of residents of the center into the society, and reduction in violent incidents in school. This requires that the center operates at optimal effectiveness, providing quality psychosocial support to the residents, and importantly, providing appropriate and demand-driven training opportunities to enhance the employment and further education prospects of those graduating from this program. The enhanced management system must be fully utilized to inform strategic planning and decision-making, and to monitor and evaluate the efficacy of policies and programs. In addition, the early screening system should be institutionalized to identify in the early grades those at risk of school failure, and thus those more susceptible to high risk-taking behavior. Improved guidance and counseling services should characterize the psychosocial support available and accessible to children in schools so that they develop the perspectives, attitudes, and skills for personal development, scholastic achievement, and career enhancement. An improved foster care system provides a preferred alternative to institutionalized care and promotes the safety and security of children in general. This project will be judged not on the existence of any system, the presence of trained teachers, probation officers, and social workers, or the functioning of this center. This project will be judged on the improvement in the indices of child protection, juvenile justice, juvenile crimes, and student achievement. Ladies and gentlemen, the effective functioning of the system requires that all critical aspects are in place. This includes the functioning of the Probation and Child Welfare Board, which we are happy to hear is in fact working and in place, and the ongoing monitoring of the Committee on the Conventions of the Rights of the Child. Coordinated work among the various agencies and departments is important for a consolidated and mutually supportive system coalescing around the provision of quality services for families, youth, and children at risk. It is indeed part of a wider citizen security thrust, promoting the wealth of the nation and the welfare of the society. Chair, we at CDB would like to encourage optimal functioning of the Rehabilitation Center. This means provision of adequate staffing, operational effectiveness consistent with the institutional arrangements for the management and functioning of the center, and of course, maintenance of the facility. The psychosocial support for the residents is critical, as are the educational programs to be delivered. However, there is need for public sensitization about the mandate and mission of this center so that there is an understanding of its limitations as much as an appreciation of its work. Please be assured that the Caribbean Development Bank stands ready to further support efforts at improving the quality of programs and services designed to enhance the quality of life within the Federation of St. Kitts and Nevis. I thank you.